Today I shall be talking about rheumatoid arthritis. This is the chronic, non-suppurative inflammation of synovial joint. It means that chronic means that it is of long duration. Non-suppurative means that no pus is formed in this and inflammation of the synovial joint. It involves symmetrical polyarthritis. It means that if wrist joint of this hand is involved, then wrist joint of this hand is also involved. If metacarpophalangeal joint of this left hand is involved, then metacarpophalangeal joint of right hand is involved. So it is called symmetrical. Morning stiffness. The patient will feel more pain early in the morning because at night during the patient is sleeping, all the inflammatory mediators get accumulated which cause pain, and after work of the whole day, the pain subsides. There will be, as it is chronic inflammation, there will be increase in erythrocyte sedimentation rate and autoantibodies will be formed. Etiology. It is of unknown etiology, but there is genetic predisposition of HLA-DR1 and HLA-DR4. Some viruses known to cause rheumatoid arthritis like Epstein-Barr virus, Mycoplasma and Chlamydia also known to cause rheumatoid arthritis, and it more commonly occurs in the females of 20 to 50 years of the age. RA factor, rheumatoid factor is found, which is the IgM antibody formed against the Fc portion of IgG. Antigen antibody complex is formed, which is called immune complexes, which incite inflammation and causes pannus formation, and it affects the joint. Synovial membrane get inflamed and the cartilage also get destroyed. Like this is the joint, femur. This is the joint. Then cartilage get destroyed, synovial membrane, tendons, ligaments all get destroyed, and there will be accumulation of inflammatory mediators which is called pannus, and nerve, tendon, ligaments get inflamed. Most commonly involved joint is the metacarpophalangeal joint. This is metacarpal and this is the phalangeal. So this is the metacarpal phalangeal joint, which is the most commonly involved. Proximal interphalangeal joint. Proximal interphalangeal joint is involved. Then wrist joint is involved, but distal interphalangeal joint. This distal interphalangeal joint is not involved in rheumatoid arthritis. Less commonly, big joints, large joints like hip, temporomandibular joint is involved. If temporomandibular joint is involved, then when patient opens the mouth, click sound is heard. Uncommon involvement. Sometimes, mostly it affects the appendicular skeleton, and sometimes uncommon involvement is cervical, spine and atlantoaxial joint. And some deformity is seen because as it is chronic inflammation, then fibrous tissue is formed and then contractures, and due to contractures deformity is seen. Swan neck deformity is seen. So what do you mean by swan neck deformity? It will look like swan neck like this. Suppose this is the metacarpophalangeal joint, this is the proximal interphalangeal joint, and this is the distal interphalangeal joint. And in this proximal interphalangeal joint goes to hyperextension and distal interphalangeal joint goes to flexion. Flexion of distal interphalangeal joints and hyperextension of proximal interphalangeal joints, which look like swan neck. So it is called swan neck deformity. There is, as distal interphalangeal joint is not involved, means that there is no inflammation in the distal interphalangeal joint, but when there is fibrous tissue formed and contractures are formed, deformity can be seen in the distal interphalangeal joint. Now Boutonniere's deformity. So opposite of swan neck deformity is Boutonniere's deformity. Like in swan neck, the hyperextension of proximal interphalangeal joint and flexion of the distal interphalangeal joint. But in Boutonniere's deformity, there will be flexion of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. Mallet deformity. What is mallet deformity? Distal interphalangeal joint, the flexion of the distal interphalangeal joint, which will look like hammer. Mallet means hammer. It is looking like hammer. And in this Hicker's thumb jet deformity of the thumb is also seen. It will look like this, like someone is asking for the lift. Jet deformity of the thumb. jet deformity of the wrist joint. In this, wrist move towards the radius and the fingers goes towards the ulna, which will look like jet deformity of the wrist joint. And in this, rheumatoid nodules is also seen. This is most commonly seen over the olecranon process. Olecranon extensor surface. This is the flexor surface and this is the extensor surface. In extensor surface of the body, rheumatoid nodules is seen. And rheumatoid nodules correlate with the severity of the disease. When the disease is more severe, means in waxing phase, rheumatoid nodules also increases. And when the disease decreases, waning phase, it also decreases. Piano key sign. What is piano key sign? Suppose this is ulna, this is radius, and the fibrous tissue get damaged. And when this fibrous tissue get damaged and we press the radius and the ulna, it feels like piano key. Talking about investigation, as it is a chronic inflammation, ESR and CRP will be raised. RA factor, rheumatoid factor will be high. Anti-citrullinated protein peptide antibody will be the specific antibody present. On X-ray, juxta-articular osteopenia is seen. What is meant by juxta-articular osteopenia? It means that when there is increase in inflammation, there will be increase in blood supply and an increase in the blood vessels, and the blood vessels is less denser than the bone. Mineral density will be decreased. So osteopenia. Deformities will be seen on the X-ray, like swan neck deformity. I have explained earlier, Bottinier's deformity. Talking about the treatment and medical management of rheumatoid arthritis, we can give NSAID and synthetic DMARDs, disease modifying anti-rheumatoid drugs. We have mnemonic for that. Elisa, please give her methotrexate. E, etanercept. L, leflunomide. I, infliximab, which is the TNF alpha inhibitors. S, sulfasalazine. A, anakinra. P, penicillamine. Give glucocorticoids plus gold salts, or hydroxychloroquine and methotrexate. And for the orthopedic treatment, we have non-operative therapy like physiotherapy, in which splint test, hot water fermentation and joint mobilization exercise is done. Rehabilitation, in this braces, walking aids is given. Operative therapy, preventive surgery, synovectomy of the wrist joint is done. Palliative surgery and reconstructive surgery is done. This is all for rheumatoid arthritis. Thank you.